Bethany TV for health.
Hello, wherever you're watching Bethany TV from, welcome to Medical Minds. And today we are still together with Dr. Underwood. And our topic for today is painful periods and endometriosis. This is still about our ladies, the girls, and the mamas. Welcome to the show, as we shall take you through the entire process of what happens in your body when you're experiencing all those cramps, all those pains, and what causes that very painful moment when you're going through your periods periodically. Thank you so much. I'm Teacher Zita. Welcome to the show as we start on at this hour. Welcome back to Bethany TV. Very good evening to you all, wherever you're watching from. And this is Medical Minds. I'm here together with Dr. Underwood once again today. And our topic for today is painful periods and endometriosis. I know you might be asking yourself what this is all about, what the term what this term means. But Dr. Underwood is here to take us through the entire explanation. Doctor, welcome to the show.
Thank you, Teacher
We're happy
Zita.
to see you once again.
Nice to see you too.
Please greet the viewer.
Yeah, good evening, viewers. And we hope to have a very fruitful discussion this evening. Thank you.
Thank you so much. How was your Sunday?
Oh, nice and relaxing too.
Lots of rain.
Yeah, lots of rain, and then had some time with my family, so
okay.
I'm okay.
That is very good.
Yeah.
And Doctor, last Sunday we had a very, very lengthy discussion, though we were cut off time, and we were talking about menstrual periods or menstruation in women, basically. Yes, and some of the topics that we didn't talk about were painful periods and endometriosis. Doctor, in your own words, as a medical expert, what are cramps or these painful periods? What are they exactly?
Yeah, thank you very much, Teacher Zita, for that question. And viewers, yeah, cramps are a form of painful periods. Period by nature normally do have some pain, but the pain should not be so much so that it disturbs your normal activity. It shouldn't be so much so that it forces you to take some medication to control the pain.
Okay.
Yeah, and the presentation of painful periods can be either in form of pricking pain or can be in form of cramps.
You feel like the stomach.
Yes,
is
sometimes some women feel like they have something's piercing, something
sharp
cutting.
cuts, yes.
Yeah, so all that to the clinical person has some clinical implication. It guides, the nature of the pain also guides the doctor as to what could be the likely cause. Yeah, so for the case of cramps, cramp means the womb is contracting forcefully and is trying to force out something. It may be that the period was too much and it's forming clots inside, and the womb is squeezing that out, and that causes cramps, similar to labor pains almost.
Sure.
Yeah, or in some people who have some masses within the womb, like fibroids which are hanging inside, the womb could try to squeeze that out, and then the woman feels crampy pain.
Okay.
Yeah, it also does happen in younger kids too. So it's, in the younger girls who have just started seeing their periods.
Sure.
So it's a form of painful period which shows us that there is something inside the womb.
A foreign body.
A foreign body, the womb is trying to squeeze it out. So that's it.
Okay.
Yeah.
Thank you so much, Doctor. Are these pains supposed to be normal in each and every woman, or some few women, or everybody has to get it?
Now, as I stated earlier, pain during periods are not unusual. Most women, like up to 70% of them, do feel some pain, even if it is no problem. But this pain should be manageable without any medication, and this pain should not stop the woman from doing her normal work. Yeah, it should be like some small inconvenience, but then after that, it should really not be so much that she has to stop working or has to change the way she works. Yes.
Thank you so much.
Yeah.
Doctor, before you go so far, what could be causing this tension in between there in the womb for the woman to experience severe pain? Yeah,
so most of the cases of severe pain during periods do have underlying cause. A few of them you cannot easily pick the causes out. We call that idiopathic, but we know if you do more detailed studies of through some tests, you could be able to find some other causes. Yeah, but the commonest causes of painful periods are things like endometriosis. Yeah, as we're going to discuss in details later.
Yes.
We also get painful periods, especially the crampy pains in the conditions where you have fibroids which are located inside the womb. They are hanging inside and the womb is trying to squeeze them out, and then you can get painful periods. Some women also do get infections. They get infections. This may be ongoing or they were there before, and then they get scars which interfere with the normal flow of the period, narrowing maybe the outlet of the cervix, and then you can get painful period as a result of that.
Thank you so much, Doctor.
Yes.
You talked about fibroids, that is in grown-up ladies.
Yes.
I work at school, and at times I have young girls who have just started their periods, and there is a young girl and who normally go through a lot of pain. She can cry, she can't walk, she cannot do anything, especially the first 3 days. Well, what can that be? Because I don't think that could be fibrosis or anything. Well, what could it really be at that tender age? She's only 14 years old.
Yeah, so in medicine we call painful period as dysmenorrhea. It's just a medical jargon, but it's referring to severe painful periods.
Yes.
Now, in young girls who have just started their period, some of them, around 40 to 50% of them do get painful periods, severe enough to disrupt their work.
True.
Yeah, and in most of these young girls, in most of them, it's not like a real pathology causing the pain.
Okay.
What is happening is the mechanism by which the period is coming. Now, in these women, in these girls, instead of the lining, because our period, the woman's period, comes from the lining of the womb. Yes. Maybe I could have a look at I think an illustration, a display. Maybe we can explain so that it is easier
for others to understand.
Yeah.
Okay.
Let's have, I think, picture number 3. Number 3, the picture of the, yes, this is it. So what is happening here is actually, so right here is the lining of the womb. This is the woman's reproductive system. Okay. This is the womb, the uterus, called also nabana.
That whitish part?
Yeah, this thing which looks like a bag. Yes, this is the uterus. Okay. Now this uterus has mainly muscle wall, but the inside is lined with some sort of skinny but thin tissue. Thin tissue, yes. Yeah, this builds up and sets off every
so that's
month.
The one that releases out the blood.
As a period.
Okay.
Yes. Now it's responding to the hormones. Now, in a lady who is more mature, who has had a period for a long time or has had birth before, down here the cervix is a little bit open. That's one thing. And secondly, in most cases, the way the period comes is this lining sets off in small pieces. So it's easy to flow out. It's easy to flow out because it is in small pieces. Yeah, the wider opening, and the lining breaks off in smaller pieces. Now, it is different for young girls. Okay. Most young girls, for them, the cervix is very tiny, very tight. Yes. So it's a narrow opening, a narrow channel. And the second thing is that in most cases, these tissues tends to slough off in one piece or 2 pieces, so it is bigger.
You said slough?
Slough is peel off.
Yes, peel off.
It tends to peel off in 1 or 2 or 3. Yeah, so you find it comes out in one piece, and it comes out as a cast. We call it a cast. So now imagine it is detached and it is inside here. Now the womb starts contracting to squeeze it out through a tight narrow. Pain. Yes. So this happens in young girls often. Okay. Yes, so in most cases for the young girls, that's what happens. That's why once that thing is out, they will see it coming out and it drops maybe in the toilet and they get a relief. and that's usually the end of the thing.
Of the pain.
Yes.
Okay.
So in most cases, that is the thing. If you ask the girl, you find that she feels that crampy pain, and it ends up with something coming out, and then the pain goes away all of a sudden.
Thank you. Thank you so much for that detailed illustration.
Yes.
Thank you so much, doctor.
Thank you.
Now, when do these cramps, these painful periods, become a concern to any lady?
Yeah, the painful periods, they become, as I told you, pain during periods is a normal event. In most women. True. It happens. True. But it should not be so severe that it disrupts their life. Now, if it disrupts their life, that means it is affecting their quality of life. Imagine each time the lady gets into her period, some women, for about 2-3 days, they are at home. They are not going to work. True. Now, she's going to have a bad record, because which supervisor, for example, in a private setting, will want to have somebody who every month has to get off for 3-4 days. Surely. So this will be too regular. True. And if she's competing with another person, this will reduce her chance of being promoted. And also, even if she's in her own setup, that is a loss of 2-3 days.
It will affect her performance.
Yes. So if the pain is so severe that she cannot perform her work, then that's a big concern, and that's abnormal. Or if it reaches a point where she cannot longer tolerate the pain and she has to take medications, and in most cases these medication doses keep on going up and up, and that is a big concern. That's not normal. Yes.
Thank you so much, doctor. Let's talk about these periods briefly. The painful periods before you go off. Someone was telling me that women who go into severe painful periods at tender ages tend to go into menopause very quickly. Is it true?
No, that is not true. The time taken to reach to menopause has no direct link,
connection to those
has
pains.
No connection. However, there are some conditions which cause painful periods, which at the same time affect the quality of the ovary as well. And one of the most notorious ones we know is endometriosis. Endometriosis causes painful periods, and especially between the ages of 20 to 40 years. And that, as part of its mechanism, it is forming cysts sometimes within the ovary. And so in that way, it destroys the ovary. That's where the eggs are as well. So much as it is causing pain, on the other side, it's affecting the reserve of the eggs of the woman. So that is the sort of link we have. But if painful period is from some other cause, maybe the dysmenorrhea in a young girl, in a girl who has just started her period, or because of some other pathology, not endometriosis, very unlikely to relate to that. Thank you so much. Just in case you're still following us, this is Medical Mind, and it's Bethan TV. I'm Teacher Zeta together with Dr. Ann. But in case you want to send us your messages, please prepare. The studio lines are 0786 050 762. We shall respond to the messages with time to come. Please prepare your messages and all the inquiries you wanted to follow up with the doctor shortly after some discussion. Doctor, I was talking to a lady who told me that after several pains, she normally blacks out. She gets severe headache. She fails to see. Could that be a medical condition, or it's just some phobia or something? At the moment, every month, the moment she's in her periods, that's what happens. She has to get a blackout. You see, the mechanism of pain affects also the nervous system. And if the pain goes below a certain, beyond a certain threshold, it can shut down the nervous system and make somebody to go into shock.
Really?
And from pain related to periods, there are many mechanisms where pain can go out of the way. For example, the one we've just described, where somebody is having some mass within the womb and it is being squeezed out, either a clot or a fibroid. Now, that means the cervix is going to be forcefully dilated. Now, when cervix is forcefully dilated,
dilating means
stretched, forced stretching of the cervix to let what is inside come out. Yes. Now, when that happens, it sends very serious impulses to the brain, and it causes the brain to send signals to the blood vessels to dilate, to widen. Now, this causes drop of blood pressure, and somebody can go in shock because of that.
Okay.
And so, painful periods are not a joke. They can actually kill somebody.
Really?
Yes, they can kill. Even in the case of endometriosis, if the pain gets beyond a certain level, it can cause the same problem.
I understand.
Yes, so
because
that may be the thing which is happening in that lady.
Because she's married, but up to now, she failed to conceive. I think maybe the uterus or the ovary or whatever in the internal system could have got some challenges, because she was asking me if there's any way her uterus could be maybe repaired or anyway, because the doctors told her through the severe pain she got some damages.
Yeah, of course, it needs to be investigated. There are many possible causes, but I suspect right from the outset she could be having endometriosis, or she could also be having other conditions like adenomyosis. She could be having fibroids, but I think which already have affected other organs like the tubes or maybe the ovaries. Yes, so if those are affected, then she needs further evaluation in a fertility setting, so that we can be able to know and explain to her exactly what the problem is.
What could be the cause of her problem.
And so that we find a solution for her.
Thank you so much. You're still watching Bethan TV and it's Medical Mind. Our topic for today is painful periods or endometriosis, and doctor is still telling us how much we should take precautions when you're having severe pains, what the causes of these pains can be, and basic explanation of what cramps are. This is still Bethan TV. As I read for you the numbers earlier, please keep preparing your questions. I'm on WhatsApp. You can still reach us on 0786 050 762. It's Medical Minds. Doctor, let's look at treatments or remedies, for curbing those painful periods and cramps, especially in young girls.
Yes, so the management of painful periods should start with identifying the cause.
Okay.
And if the cause is evaluated and attended to, that pain should be managed. But if the cause is not there and it could not be prevented or could not be managed, then you can go for remedy for pain management.
Okay.
But I need to emphasize that it should start with identifying the cause of the painful period. If it's endometriosis, that should be treated.
Okay.
If it's a uterine fibroid which is hanging inside, that should also be treated, and that should take away the pain, because apart from the painful period, there are also other complications related to this.
True.
But now in a younger girl, yes, if it's because of the condition we described of endometrial casts which get peeled and pushed out, then we need to see what level of painkiller can be of help to her.
Okay.
And that should be managed for a certain period of time, and other interventions should be now brought in. Sometimes we have to give them some hormonal medication to reduce on their flow as well. Sometimes to delay the period a bit, we do that as well.
Okay.
Yes.
Thank you so much. Doctor, how long should the pain be? Does it take the entire 7 days or 6 days, or just at the beginning of the menstrual cycle?
It's variable, really. Normal menstrual period pain is variable. In some people it comes before. In others, it is
before the body is preparing.
Yes.
And the moment the period comes,
it
the pain
goes down.
Okay.
In some people, it goes on for the days they're having their periods. Sometimes it depends on how heavy somebody's period is.
Okay.
But what underlines both is the characteristic for a particular person should be maintained, and then also should not disrupt the person's work. Yes.
Okay. Someone asked me a question that can you please ask the doctor how long, as a young girl or as a lady, I should wear my sanitaries? How long should it be? How safe is it? Like, can it take the whole day or just few hours? Yeah. So,
the sanitary pads, the most important work of them is to collect the blood so that the blood doesn't have to run on your clothes and doesn't have to inconvenience you. That's really the most important use. Otherwise, if that was not of concern, there will be no problem with having the blood come out without any control. But it's a social problem, really. Yeah. But how long you should wait? So how long you should have a sanitary pad? It depends on.
Yes.
Yeah, it depends on how long it gets to fill up, to the extent that it inconveniences you.
Okay.
Yeah. But on average, having 2 or 3 sanitary pads in a day is really okay.
Okay.
Yeah.
Thank you so much.
Yeah.
Doctor, let's go back to the pain briefly. I imagine I'm in the village.
Yes.
I don't have painkillers.
Yes.
And I cannot afford medical condition treatment or something like that. What remedy can a young girl or a lady in the rural setting use in case of those pains?
Yeah, actually, first of all, we also don't encourage people to go straight away to medications.
Okay.
We encourage them to look around and use what is available to them. One of the things is, first of all, improved nutrition is another way of improving the quality of the period as well. But also, in case the person can manage, they should do exercise. Exercise improves period pain.
During the period?
It should be throughout your life. It improves, because one of the things which affects your response to pain is how well your muscles are trained. Yes, how well your muscles are trained improves how you manage pain as well. But apart from that, there are other remedies like temperature management. You can use hot bottles placed on the abdomen, warm bath.
What hot bottles? Can briefly explain that. How do you get a hot bottle?
Hot water bottle, not hot. Sorry.
Hot water bottle.
Hot water bottle, sorry.
Okay.
Yeah, so the simple bottles you use for soda, you can use that, fill it with water.
With hot water? With
hot water.
Okay.
And then make sure you cover it with some bit of towel or clothing.
You wrap it.
Wrap it.
Okay.
And then you put it on the lower belly.
Okay.
Yes, and that
pain.
it does help.
Okay.
That simple remedy can help so much.
Thank you so much.
Yeah,
Doctor.
you can even use a cold one as well. Some people respond better to cold. If you have a fridge, you put very cold water instead, and then you also wrap and you put in those areas.
Okay.
Either hot or cold, they work.
They all work.
Yes.
Thanks so much, Doctor. We are still discussing about endometriosis and painful periods, and Doctor is still trying to give us some remedies on what to use or how you can curb the pain, just in case you don't have any first aid or maybe the simple medicine, or you cannot afford to buy those first painkillers during that moment. So you can use a bottle, wrap it around with a towel or any piece of cloth, and wrap it around or put it around your belly. That is all about painful periods. Please, in case you're following us wherever you are watching from, I'm Teacher Zita with Dr. Underbert, and we're talking about painful periods. We're now going to look at endometriosis, the topic that everybody has been waiting for, and Doctor is right here, ready to answer your topics about this. Doctor, let's now look at endometriosis.
Yes.
Yes. What is it all about? Can you kindly define it?
Yes. So endometriosis is a medical condition.
Okay.
It's actually a disease, and to understand it better, it affects women, of course. To understand it better, you have to look at, again, the reproductive system. Now, the period of a woman is coming from the inside of the womb. There is that thin lining of the skin,
yes,
which we had pointed out before, around here.
Yes.
So the period is this lining of the womb,
okay,
setting off every month.
Okay.
Now, in normal circumstances, this lining of the womb should be only within the womb. This tissue is specialized tissue. It should be only here. Within the womb cavity.
Okay.
Only there. Yes. Now, in endometriosis, what happens is that tissues similar to this start developing inside, outside the womb. It starts developing in abnormal sites. Yes. And that is what we call endometriosis. So in essence, endometriosis is a disease condition where tissues similar to the one which lines the womb, called the endometrium, develops in other sites outside the womb.
Yes.
Okay. So what is important is where these tissues are, they respond to the hormones, just like the lining of the womb. Now, every month, the lining of the womb is responding and it is setting off. A similar thing happens. So, what you're having is internal period.
Okay.
What the woman is having is actually internal bleeding,
that is
internal
during
period.
Endometriosis.
Yes.
Instead of the blood flowing out,
yes,
it collects somewhere.
It collects inside. Because these sites are bleeding, just like periods. So you're having periods from the surface of the ovary, periods on the surface of the womb, periods from the tube area where those disease spots are. That is called endometriosis. Now you can imagine the blood is inside, it's not coming out.
It's not coming
and
out.
It's irritating inside. Now as it is irritating, it's causing scar formation and tissues stick together. The tubes can stick together to the intestines, can stick together to the ovaries, and you can imagine what that can cause. It can cause dysfunction of the period of the tube. It can cause pain, severe pain. It can form cysts inside because that blood can collect and form a cyst anywhere, and sometimes inside the ovary. Yes.
Thank you so much, Doctor.
Thank
Whenever
you.
you're watching Bethany TV from, I hope you've got the clear, the very clear and brief explanation of what endometriosis is, because a friend of mine asked me earlier on what it's all about, but I could not explain it because I'm a teacher, I'm not a medical personnel, so I was all along waiting for Doctor to tell us all his knowledge as far as this term is concerned. Doctor, what kindly first give us its presentation again. When you have endometriosis, outward as you as a woman, does it look like it's swollen or the tummy remains flat? That's because they are pile up of blood tissues, right?
Yes.
Yes. So what are its presentations in you as a woman?
Yes. So how you know that you have endometriosis?
Yes.
Yeah. So first of all, simply if you want to remember endometriosis, I think many people know endometrium, which is that lining of the womb.
Thanks so much, Doctor. We are going to have a very short break, and when we return, he will take us through the entire explanation and more illustration of the presentation of endometriosis in a woman's womb. Stay with us.
Bethany TV for health. This is the Health Minute on Bethany TV.
Antenatal care is a care package offered to pregnant women. Here are some of the benefits of the package.
As you visit the hospital, the doctors or the health workers will be able to know if your pregnancy is at risk or not.
A birth plan is discussed, provides nutrition assessment, advice on and nutritional supplements for the mother.
Even during the antenatal care process, we are able to do scan. You're able to see the sex of your child, and we're able to determine, we're able to tell if your baby is at risk of ending into a premature baby or not.
Screening and treatment of HIV and STIs.
We are able to screen you for very many various tests, for example, like hepatitis B, malaria, HIV, sickle cell, and very many other diseases.
All these are important for a healthy pregnancy and a healthy baby.
Better health care for a better tomorrow. That was the Health Minute. Ladies and gentlemen, we are thrilled to introduce Bethany Santa Omugabi, who will be sharing wonderful goodies with you this Christmas season. Getting a chance to meet Bethany Santa Omugabi is easy. Just tune into Bethany TV and get to know our various programs and talented presenters. Bethany Santa Omugabi will make surprise appearances during our live programs and offer Christmas hampers filled with an assortment of goodies, including healthy food items. When you spot Bethany Santa Omugabi during any of our programs, be the first to call in and say, "Hello, Bethany Santa Omugabi. I am your Christmas date." He will then ask you a simple question about our programs and presenters. If you answer correctly, you instantly win a mega Christmas hamper. But that's not all. You can also respond on social media. The first 20 people to respond to each question on social media will be entered into a draw. And lucky winners will be picked and announced during Bethany Santa Live on Saturdays. Bethany Santa Omugabi, only on Bethany TV. For health.
Well, I have two best memories about Christmas. These used to happen every year, but they were always so super special. And one of them was we always looked forward for that to that day because we knew there were new clothes coming in. You know, you wear these clothes Sunday morning, they still have those foldings from the pack, from the plastics. And then the other thing was, of course, just like every other home, we ate too much. You would not feel hunger until like after Boxing Day. So there was a lot of food and nice clothes. Ladies and gentlemen, my name is Javi Bwesige and I'm the audio producer at Bethany TV, making sure everything is packaged right to your liking and to the best of our knowledge. And Bethany TV is for health. If you want to keep your health in check, you want to talk to experts, you want to just make sure that you are good, living healthy and living all right, do not touch that dial. Keep watching Bethany TV, for everything good is coming from us to you. Ladies and gentlemen, have a Merry Christmas and a Happy New Year 2024.
Bethany TV, for health.
Welcome back from wherever you're watching Bethany TV from. This is Medical Minds and it's me and Dr. Underbart in the studio today. We are discussing painful periods and endometriosis. Doctor, you are still telling us about the presentation?
Yes. So the presentation of endometriosis. As I had explained before, endometriosis, that means tissues similar to the ones which are inside the womb are developing in other parts. Okay. So that lining of the womb is called endometrium. That's where the name endometriosis comes from. Okay. Now, in terms of presentation, the commonest presentation is usually pain. Okay. Painful periods, and these pains are very, very characteristic. These painful periods are very characteristic. One, they are so much that you need something to manage them. Two, they increase with the period.
So meaning the flow is heavy?
The pain increases, especially the pain. Yes, the pain increases with the subsequent periods. If you take, for example, from January, by the time you reach December, the pain will be worse. If you are controlling with medication, you will need a higher dose of the medication. So they typically get worse over time. And very often, endometriosis presents with other forms of complications like infertility. Yes, you find somebody has tubal issues because of the endometriosis and they have been trying to conceive and they're not getting pregnant. They have painful periods. Typically, that is endometriosis. Okay. Yes, but also they may affect, depending on which organs they affect, which other organs they affect. Okay. Yeah, sometimes they may affect, for example, the intestine. Somebody has issues with stool. But also endometriosis can
talk about stool. Yeah. What issues does one get with the stool?
Yeah, so depending on which part of the gut is affected, it might cause even constipation or pain on passing stool. Is one of the commonest indicators that somebody has endometriosis.
Okay.
Yeah.
Thank you so much. We have some concerns and messages coming in from our viewers, Doctor. Yeah. Just in case you're sending your messages, kindly tell us where you're sending your message from or where you're calling from and your name so that the doctor can understand better on how to address you. This is Nansu. She's saying, Doctor, my daughter gets severe cramps and becomes severely anemic sometimes. Is this normal? what would be your recommendation for this condition?
Oh yeah, so thank you for that question. Sorry,
Yes.
I didn't get her name.
Nansu, she's called Nansu.
Yeah, Nansu, thanks for your question. Now, this problem you are describing is common in girls, painful periods. About 40 to almost 60% of the girls do have painful periods, the young girls. But that should not cause severe anemia. Should not cause anemia. Now, if painful periods are associated with anemia, that means most likely the flow is heavy.
Okay.
And that usually is an indication of some underlying condition, like either fibroids or an additional condition called adenomyosis. Adenomyosis is different from fibroids.
Okay.
It is also different, slightly different from endometriosis. Yeah, so it's usually with the painful periods, but the periods are usually heavier. Yes.
So meaning when a girl experiences heavy periods,
yes,
they are losing a lot of blood and they
yes,
can become anemic.
Yes. So if she's getting anemic, that means she's losing too much blood.
Okay.
Yeah, so she really needs to be evaluated, and that's even more dangerous for her.
So she needs to go for medical condition.
Yes,
for
she needs
medical,
to
she
be
has to be
checked
attended
up.
for. Okay.
She does. She
Thank
really
you.
needs, yeah.
Thank you so much. Now, so I'm glad the doctor has answered you. I hope you're going to follow up that precaution, and please make sure you take the girl or the child for some medical follow-up. This is Calvin is saying, hello, teacher Zita. This is Calvin watching from Chewenda. I have a lady with me, but she receives the period. She undergoes through pain for 3 days. So help me, how can she overcome the pain? We have a call on the line though. Calvin, doctor will answer you briefly, shortly after that. Bethan TV, hello.
Good evening.
Good evening to you. How are you?
I'm fine.
Where are you calling from?
I'm calling from Nansana.
Nansana?
Yes.
What's your name?
My question is quite different from the topic we're discussing.
Okay.
I wonder if to ask.
Please go on.
Okay. My issue here is I don't experience any type of pain
Okay.
when it's my period time.
Okay.
But my worry here is my flow usually like clothes.
Clots.
Small clothes.
Okay.
And the blood is a bit tough.
The blood is a bit?
Any reason for me for worry? Because I'm just confused by this is working down.
Okay. Thank you so much for your call, doctor. Her concern is about the flow. Though she was breaking off, there are some words I couldn't hear very well. But she's saying she doesn't get pains, though her flow is full of clots. Yes, and they are big, big clots. What could be that? Because I know a normal period has to be clean, and yes, not so puffy at least.
Yeah. Yes. So yeah, of course, some parts of the question were breaking off, but I think she says that her periods are with clots. Maybe that's her bigger concern. Yeah, normal periods should not be having visible clots. There may be tiny clots, that's okay, but they should not be visible. Now, if you start seeing visible clots,
Visible
clots in the period, that means the period is heavier. That could be an indication that you could be losing more blood than normal.
Yes.
And therefore you need to be evaluated.
Okay.
There are conditions which give this heavy flow of periods. One of them I told you are adenomyosis. One of them is fibroids. And so you need to be evaluated by a gynecologist. Yes.
Thank you so much. And it's still back on Calvin. Calvin is saying the lady he stays with have severe pains for 3 days when she's going through menstruation. How best can you help her? Yeah. How best can you help her?
Yeah, so this is already indication that the period is affecting her normal lifestyle, and so we have to evaluate the underlying cause.
Okay.
It could be any of these conditions, endometriosis or adenomyosis, or it could be fibroids.
Okay.
Yes, one of those conditions must be the cause of that.
Okay.
She needs to be evaluated for sure.
She needs to go for medical checkup.
She needs to be checked.
Thank you so much.
Yes.
Calvin, I hope you've got your feedback from the doctor. Kindly get time and visit a medical expert so that you find out what the cause of that severe pain could be. Thanks so much. We're still continuing with our discussion. It's still Medical Minds and it's painful periods. Doctor, we're still on endometriosis.
Yes.
Yes. How does one know that they really have it before going to the hospital?
Yeah, so endometriosis, of course, for the person who has it, who is not a medical person, it should be just suspicion. We suspect it from if somebody is having painful periods, or if somebody is having some alterations of the periods. Sometimes it causes irregular periods as well. Some cases present with irregular periods. But the commonest presentation is really painful periods or infertility as such. A few cases present with the cysts.
Doctor,
you feel
just
a
a
mass
moment.
inside.
We have a caller. Someone wants to talk to you.
Okay.
Bethan TV, hello.
Hello,
Hello, my dear. What's your name?
my name is Julia.
Julia?
Julian.
Julian, yes. Welcome to Bethan TV. Please go on.
May I want to ask the doctor,
Okay.
like when the mass comes,
Okay.
I feel a lot of pain for 2 days,
Okay.
and I spent a lot of pain in my back for 4
Okay.
days.
Okay.
Yet I feel a lot of days.
Okay. Thank you so much, Julian. Is that all?
Yes.
Thank you, Julian, for calling Bethan TV. Her concern is a lot of pain. Yes, I think in her womb and then at the back, serious back pain for 4 days. Yes.
Yes, again, this shows that painful period is a very common condition. And the management should start with finding out the underlying cause. And until that is done, then we should not
It might be hard for you to just...
Yes. But she needs an evaluation to find out what is really causing this. There are tests which can be done.
Okay.
They could do scan, they could do even examination, physical examination. Yes, sometimes they go a further step and they do things like MRI to try and find out the exact
cause of that pain.
Yes.
Thanks so much. Have another call on the line. Bethan TV, hello.
Hello.
Hello, dear.
Yeah, thanks for the show.
Thank you. What's your name? Where are you calling from?
Mwanga calling from Kono.
Mwanza?
Mwanga calling from
Mwanga. Yes, please.
Well, I wanted just to know what makes a lady not conceive. Like I've spent with the money for like 7 months to 9 months.
Okay. Thank you so much, Mwanga, for calling. Doctor is right here to answer you back. Thank you. Mwanga's concern is that he has spent a lot of time, some months, with the lady, but the lady is 7 months,
yes.
but the lady is not conceiving. What could that be?
Yes, thank you so much, Mr. Mwanga, for your question. First of all, in terms of in a medical perspective, 7 months is a little bit of a short time, but of course, if somebody is concerned, you have to address that. We usually get concerned if the delay is beyond a year. But if the lady is older than 35 years, then 6 months is a concern.
Surely.
Yeah, but there are different causes for different reasons why somebody may delay to conceive.
Okay.
Yeah, but we have to understand that for somebody to conceive, about 4 things must be functioning well. One is she needs to the lady should be producing eggs and quality eggs every month, possibly. Her tubes must be functioning well.
Okay.
And then the third thing is, as the man, his sperms should be okay. In terms of the sperm count should be okay. The other parameters of the sperm in terms of the shapes and their movement should be fine. And finally, the womb should be okay. So we look at these 4 things, and remember that 3 of the things, the issues may be in the woman, but the third one may be the issue. So you may be looking at the woman, but the issue may be with you as
with the man.
Yes, with the man.
Okay.
So it's important that you get evaluated to understand how are your sperms, Mwanga. That has to be tested. How are the woman's eggs? That has to be tested. There are tests to do that, both clinical assessment and also some tests in the lab can be done to find out if she's ovulating. And then the third thing is the tube. There are some tests to evaluate the functioning of the tube, at least, and also the womb. There are also tests for that. So we need comprehensive evaluation of you as a couple.
Okay.
Yes.
Not only looking at the woman.
Yes.
Mwanga, I hope you've got the feedback from doctor. You need to take a step and find out about yourself too. It's supposed to be a team thing. Move as a couple, move as a family, and seek medical help. Perhaps you might discover what the problem could be. We have more question on WhatsApp. The doctor, she's saying, "Hello, doctor. I am Eunice. I don't get my periods regularly. I often skip my periods, and when they come, the flow is too small to the extent that sometimes I use only a half a pad daily. I did a scan, but I don't have anything like fibroids. Will this condition affect me in the future?" That is Eunice. She's saying she does not get periods. Yeah, she does not get regular periods, and when they come, they're very, very small. The amount of the flow is very small.
Yeah. So thank you. She's called Judith.
She's Eunice.
Eunice, yes. Thank you, Eunice, for sharing that problem. Now, from my assessment, that just to tell you that a period is shedding of the lining of the womb, but it's an interplay between the womb and the hormones, which are usually from the ovaries. So the hormones make the lining of the womb to grow, and as they change over in the second phase of the cycle, they cause the lining to shed off in case pregnancy doesn't occur. Now, any alteration in the period, whether in terms of the period being regular or irregular, whether the amount is much or less, is an interplay between the two. So we need to understand, apart from the scan which you did, we need to look at how your hormones are. That should be interpreted together. The womb and the hormones, estrogen and progesterone, but also other hormones must be done. So this needs an evaluation by preferably a reproductive endocrinologist. That is somebody who understands the details of the hormones in the reproductive system. You can come over to our unit. We will be able to assist you. Thank
you so much, doctor. Someone is saying, "Hello, Bethany. I've never had dysmenorrhea before, but of late I have painful periods. I get clots instead of a normal flow. 5 years ago, I was diagnosed with benign cyst. What could be the problem?" I'm Carol. This is Carol.
Yes. Yeah, thank you, Carol, for sharing that. You said you've had cysts before, and that was diagnosed about 5 years ago. Now you're having painful periods, and they are heavy. Now, this needs there are things which definitely come into the mind when you have such a situation. It could be still the cyst coming up, but also it could be something else within the womb now showing up. The same condition called endometriosis or adenomyosis could still be playing a part. Again, you need an evaluation. This is something you need a comprehensive assessment. A gynecologist must assess you properly, and preferably somebody who also understands the hormones as well.
Thank you so much. I think, Carol, you've got your response from the doctor. Please, whatever condition that you're going through as a lady and you're not sure of what it could be, please take precautions and go and find out from the medical experts who can do a scan or any other help from them than sitting home and waiting for other symptoms to show up.
And they can bring complications as well.
Yes. He's saying, "Good evening, doctor. Thanks for the program. My question is, what are the causes of endometriosis?" We're going to look at that, Jackie. Don't worry. We are going through that that topic or that question shortly. This is saying, "Hello, Bethan TV. I'm Gift from Lozira. Do you work on hormonal imbalances, please? Because I have been with irregular periods from the day I started my periods in 2009. I can spend like 5 months without getting them, but once I get them, still the blood can't stop until I first take tabs or injections to stop the blood. And again, I've never used family planning. I'm 30 years, no child yet. I'm so scared and worried if I will conceive. Kindly help me up. This is, she's saying, gift? Yes, that is gift. Yes, that is her concern. Yes.
Yes, so yeah, again, thank you, Gift, for sharing the problem you're going through.
She has hormonal imbalances.
Yeah, she talks about hormonal imbalance, and it's presenting with her missing periods, and then when the periods come, they are heavy, and she has to take medication to stop them.
Yes, sure.
She's also getting concerned that she's delaying to conceive.
She's worried whether she will conceive.
Oh yeah, okay. She's worried that
she's 30 years old.
She's 30 years old. She's worried that may affect her ability to conceive. Yeah. So hormonal imbalance is a condition which people diagnose commonly. But basically, what they are saying is that the hormones are not in the normal ranges for that particular part of her cycle.
Okay.
And yeah, but this is not very specific. What we need to do is you need to have your results assessed by a reproductive endocrinologist. We have a number of them in our unit, so that your problem is classified. You seem to be describing something similar to what we call PCOS, polycystic ovary syndrome, and it presents with that type of picture. But you have to be evaluated. You come over and then we look at your test. There are some few tests we do, even some scans. There are some scans to look at your ovary, and then we look at your hormones and we classify your condition.
Thank you.
Yeah.
She's also saying, Doctor, is there any way I can locate you? They want to know your location, where they can find you, or you can share your contacts, or maybe you can briefly tell us where someone can find you.
Okay. So in particular, I work at Bethany Women and Family Hospital. Of course, we work in a group. I have like about five doctors with whom we work in this field, and so. But I work there almost every day, and you can access me through the hospital. Yes, through the hospital you can access me, and we can give you the contact. We will share the contacts through the social media, and you will find the contact to make a booking.
Thank you so much, Doctor. I'm glad you've answered the question. Gift, in case you need to find Doctor, go to Bethany Women's Hospital. The nearest one is around Entebbe, near me.
There's one in Luzira.
Yes, we have a branch in Luzira.
There's a one next to you.
Yeah, there's one very close to you.
And that's the one where I work.
And that's where Doctor works. You can call, you can just go there and find Doctor. And if you need him specifically still, you can inquire, and
you can come
he
over.
attends to you. Yes, just go to Bethany Hospital in Luzira. You'll be attended to. And our last info here is saying, hello, dear doctor, good evening. I have a question, and it's like someone goes into menses without any disturbance, but after finishing, she feels a lot of pain in the left lilac region associated with back pain for 2 days. Yes, what could be the cause of that? What is lilac? Something lilac?
Iliac. Iliac is the
iliac?
ridge.
Lilac.
I think iliac.
Iliac. I think she wrote it wrongly. Yes, it's iliac. Iliac. Okay.
Yeah, iliac is part of the lower abdomen, the one which is on the side. So if you divide the abdomen maybe below the umbilicus, the lower part can be divided into 3 parts.
Okay.
The one on the left, the one on the right, then the one in the middle. So the ones on the sides, either left or right, are referred to as the iliac. I think that's the region which has ovaries on both sides, and they have ovaries on both sides, in a woman especially.
Okay.
Now, if somebody is having pain following periods, this is also a form of painful period, but this is typically presents in people who have like cysts which are resulting from endometriosis. So the period collects inside, and it makes the cyst to swell, and then you have a continuation of the pain.
Okay.
But it could also be something else.
Yes.
So she needs an evaluation.
Thank you so much.
Yeah.
I think the doctor has answered your question. Now let's go back to our topic of discussion.
Yes.
Doctor, let's look at the risks and complications. Yes,
somebody was asking about the causes, no?
Yeah,
okay,
the causes. I think we looked at, we looked at the cause. I think someone asked about the causes, and we had not yet gone in there.
Yes, I remember.
Let's look at the causes before we go into the risk and complications. Yes, the risk, the causes of endometriosis.
Yes. So endometriosis, the truth is the medical world has not identified the exact cause. Like malaria, we know there's a parasite which causes it, malaria. That's we call it. In diabetes, we know it's because of the management of the sugar, how the body is metabolizing the sugar. We know the exact cause. But for endometriosis, we do not know the exact cause. This is the truth. But we do know some risk factors from knowing the numbers and some characteristics of the people who get endometriosis. There are risk factors which we know. One of them is genetic.
Genetic.
Yes,
so it can be inherited from your mother to you.
Yes. What you're inheriting is some genes which increase your risk of getting endometriosis. So it doesn't mean everybody will get it, but it increases your risk of getting endometriosis. Now, there were a number of theories about other risk factors, like the backflow of periods, that the periods from the womb will be flowing. Instead of flowing out through the cervix, they flow through the tube backwards. This has since been disapproved. Of late, we are beginning to identify some association between some chronic infections of the pelvis and the endometriosis. Also, malnutrition. Chronic malnutrition has been of late related to this, but we don't have an exact cause.
The cause is not yet known.
Yes.
Okay. But I think basically it's more of hereditary.
Hereditary seems to be the strongest factor we can see.
Okay.
Yep.
How about the treatments? Are there some treatments that we can have so that is permanently cured?
Oh, yeah. So endometriosis, the outcome depends on the stage where you get endometriosis. If it is picked early, you can actually eliminate the disease, especially those which are presenting in form of cysts within the ovary. But in common practice, people usually present late. And so you are dealing with the endometriosis, but you are dealing with this complication. And sometimes it has involved so many things so that you don't have the opportunity to remove all of them, to deal with endometriosis, to remove it. So in our clinical practice, you find your management is more of trying to reduce the effect of the disease. Yes.
Okay. Doctor, is endometriosis similar to fibroids? Like, before we go to that, how is it treated? Is it through operation, tablets?
Yes, so there are a number of modalities of treatment of endometriosis. Yes. The very mild cases don't need treatment. People need to know that. Those which are discovered accidentally. But other forms of treatment include medications. There are medicines we can take. Some of these medications are as simple as the normal family planning pills. Sometimes we put some people on family planning pills, and that is enough. And some of them, there are some specific medicines which manage the pain. Others control the hormones to manage endometriosis.
Thank you so much.
But some cases you have to do surgery.
Okay.
Yes, to remove the disease.
To deal with it completely.
Yes.
Thank you so much, Doctor. We're running short of time. I think we've almost come to the end of our discussion. Our topic was painful periods and endometriosis with me, Teacher Zita, together with Dr. Andobert. In case your questions have not been answered, please feel free to send questions on the WhatsApp number of 0786 050 762. Doctor will get back to you where possible. And in case you need the help, you need any medical attending, please go to Bethan Women Hospital around Luzira and one around Entebbe Road. I've been Teacher Zita together with Dr. Andobert. For now, with my team, we are signing out of Medical Minds. Till next Sunday, have a very good evening.